Most oftentimes when I get a referral for cognition, it's either due to a brain injury, so a stroke, or maybe someone has fallen, gotten in a car accident, something like that. We also will get referrals for patients that are maybe living independently or semi-independently, and their family may be concerned about their ability to live that way safely. So they will call us to go in and do a number of different things to kind of check and see how well they can make decisions and complete tasks on their own. Typically, testing for dementia is pretty standard across the board. We use a couple of different tests, one of them being the MiniMental state examination, a cognitive screener. It looks at a number of different areas. The first thing it looks at is orientation. So it will test the patient's knowledge of where they are, the year, the date, the day of the week. From there, it moves into more memory assessments. So it will look at immediate memory. I will ask the patient, I want you to remember 3 words for me. Those words are apple, book, and coat. And then I will ask the patient, what were the words? So it tests their immediate recall of what I just told them. I will ask them to do one of 2 things. Either they start from the number 100 and count backwards by 7s, or I will ask them to spell world backwards. Once they have completed that, then I will ask, okay, what were those 3 words that I wanted you to remember? So that will test more of their ability to recall from longer ago after a distracting task. So after we test that, we'll go into some more immediate recall where they have to repeat after me. And they have to follow a 3-step direction on their own. I ask them to write a sentence for me. I ask them to copy a design for me. And then after they've completed all of those things, we will get a score that's out of 30. 20 to 25 is kind of that mild to moderate impairment range. And then typically anything below 20 out of 30 is pretty severe, really in that dementia range. And typically after I get a score, depending on what it is, I'll go into more specific testing. If they are an active member in society, they like to do a crossword, they read the paper every day, those are great exercises for the brain. And so typically those patients do better on cognitive testing, whereas if I have a patient that has been maybe at home alone and they watch a lot of TV, they don't exercise their brain, they're typically going to have more impairments than a patient that's really active.